Hello, everyone, and welcome to today's briefing. It will be conducted by our Executive Director, Natalie Mera, and we will be discussing the outbreaks, the funding announcements, and the staffing issues that exist in long-term care. And then that will take about 10 minutes, and then we will open up the chat to questions. So if anyone has any questions for the Q&A portion, please enter it in the chat for Zoom down below. And then I will read out the questions during the Q&A portion.
Thank you. My name is Natalie Mera. I'm the Executive Director of the Ontario Health Coalition, and we represent about 500,000 people, including patients and residents and family councils, staff and their unions, health professionals, doctors that support public Medicare, seniors organizations, ethnocultural organizations, and a range of civil society organizations that support public health care under the principles of the Canada Health Act. And it's this perspective that we bring to analyzing what's happening in long-term care. This briefing is about what's happening in Ontario's long-term care system now, and the recent sort of slew of government announcements over the last week around funding and staffing, just to break it down for people. So in terms of outbreaks of COVID-19 in Ontario's long-term care homes, we are in a second wave, it appears, and things are getting more serious daily. There are now about 50 outbreaks in long-term care homes across the province. Some of them are quite small, so they are being sort of arrested at 1 or 2 people, not to in any way diminish the experience of those people. But some of them are quite large, particularly in Ottawa, where there are about a third of the province's outbreaks are happening now. Some of them very large indeed. Extendicare's West End Villa is the worst at the moment across the province. More than 100 people have been infected with COVID-19, staff and residents in the home. At least 19 have died. I'm really sorry to report. There are also outbreaks at 5 other extended care homes in Ottawa. There are large outbreaks in Toronto now, and several that we're just hearing in across the province. So like last spring, we are seeing the numbers escalate in long-term care in a very alarming way. But what we have not seen is a fundamental change in the response to the outbreaks in the homes. There are homes, of course, that are doing a tremendous job and have staffed up and are moving very quickly and following infection control guidelines and more, and really responding very well. But there are homes that are not. Extendicare's West End Villa, I think, gives us very sort of alarming evidence that the requirements by the Ontario government for the homes have not improved since last spring. Extendicare on September 11th, the local chief medical officer of health in Ottawa reported that they had checked in and that there was enough PPE in the home. The Ministry of Long-Term Care spokesperson reported that they had checked in and there was enough staffing in the home. The reports from the families were completely the opposite, families and from the staff. The next week, staff reported to CBC, of course anonymously because they can be fired for speaking out, that the frontline staff who were treating residents with COVID-19 did not have access to N95 masks in that home. More than 24 staff had by that point contracted COVID-19 in that home. Families reported their loved ones lying next to in a shared room with a resident, one family with a resident that was COVID positive that had been developing symptoms over a number of days. It wasn't until days later that the person got tested, and then they had to wait for their test result, and then it still was more than 24 hours until their loved one was moved. and isolation started to happen. In the meantime, 4 people were sharing one bathroom with a COVID positive resident. Another family has described to the media their loved one COVID positive in a room with a door open, other residents wandering in and out without proper isolation, proper protection. It was not until 2 Mondays ago that the Chief Medical Officer of Health in Ottawa ordered the Ottawa Hospital to take over the management of the home and send in a rapid response unit to help. That was after well over 90 residents and staff had contracted COVID-19 in that home. As of the most recent media reports coming out of Ottawa, the home is still waiting for 270 test results from residents. It's not clear if that's the second round or multiple rounds of testing or the first round. But the bottom line is that all of those mistakes, all of those inadequate responses are what we saw from homes with terrible outbreaks in the first wave of COVID-19. And what we would have expected to be developed would be some kind of cross-province systemic plan that says there's a low threshold when 1 or 2 people are infected with COVID-19, these measures snap into place. You know, there's staffing gone into the home or somewhere for the residents to be moved to where they can get safe care, be it a hospital or a field hospital or the like, subject, of course, to their right to consent. There's full testing, you know, there's full PPE, all of the isolation procedures and so on should have clicked in right away, and there should have been a method to do that. What's clear from Ottawa is that there is no systemic approach, and we know from the summer that nothing has been done to improve the critically short staffing levels in long-term care homes across Ontario. There were critical shortages of staff in long-term care prior to COVID-19. They started to really emerge around 2017 and become very serious indeed in the last couple of years leading into COVID-19. When the pandemic started, we saw a loss of staff in a number of homes across the province. As many know, staff had to choose one home to work in from multiple part-time jobs. And so some homes lost a lot of staff through that. Staff got sick, they had childcare issues, they left the sector. Many homes were reporting worse staffing at the end of the first wave than they even had going into the first wave. In the beginning of July, from July 11th to July 17th, we did a staffing survey of long-term care homes, asking staff, does your home have more staff, the same, or less staff than prior to COVID-19? The majority of them said, the vast majority of them said it was worse. More than 93% said that they were working short-staffed every day or 3 days a week or the majority of the time. They talked about the for-profit home staff reported worse staffing levels than the nonprofits and the public homes, but across the board, staffing is inadequate in long-term care homes. In Ontario, even with the announcements from the last week and a half, no measures have been taken to get the thousands of staff that are needed urgently into the homes to get the care levels up to safe levels. In the last week and a half's announcements, the government announced a bump up for funding for long-term care, which is actually significant. It was just about $403 million. That's for extraordinary COVID costs, and it amounts to about $44 million for all of the 626 long-term care homes in Ontario each month. So that is a significant bump up. However, the money from the summer still has not flowed yet. They just flowed June's money in September. Homes are waiting for July and August's money, and that may help to explain why we didn't see staffing improvements in June and July. But also the number of staff that the government has announced is far too few. For healthcare in total, they announced 3,700 new staff. But then when we looked at the numbers more closely, a number of those are not fully funded. So they announced 18 million for a nursing graduate guarantee program that is supposed to buy 600 nurses, focused on recruitment in long-term care and hospitals. But when you do the math, that actually only amounts to $30,000 a nurse. So that does not actually buy 600 new nurses. It may top up some nurses to full-time hours, but it does not actually get 600 new nurses. They announced up to 8 million for 800 nurses in the health system in areas of need across the province. But when you do the math for the money, it's 8 million for 800 nurses. It amounts to $10,000 per nurse. Again, that, $10,000 does not buy a nurse. So these announcements were a lot of PR without really a lot of substance behind them in terms of just the sheer numbers of staff that are needed. To put it in context, in June, so that is now June, July, August, September, October. So 4 months ago, the Quebec government launched a strategy with the full weight of government behind it to recruit 10,000 PSWs into long-term care. They did that over the summer. They recruited them. They're paying them $21 an hour to train them, $26 an hour to work in long-term care. Just last week, they announced they're hiring a manager for each long-term care home, 400 long-term care homes in the province. They're going to pair them with an infection control specialist to ensure that infection control guidelines are followed competently in all of the homes in the case of new outbreaks, which they had a problem with in the first wave that was actually worse than Ontario's, but we have had a very significant problem with it, as we see at Extendicare West End Villa in Ottawa. So that's Quebec's response, a full response. The government recruited the staff, they trained them, they paid them for training, they stabilized the wages in order to get them in. 6 months ago, BC's government acted by providing a wage top up to $21.75 an hour for PSWs and providing PSWs with full-time jobs in order to stabilize the workforce. And the Canadian Medical Association Journal came out with an article just last week that compared the response of Ontario and BC and looked at why British Columbia had a lower death rate from COVID-19 in the first wave. And one of the key factors was that they moved very early on to stabilize the staffing and get full-time staff into the homes. That has not happened in Ontario, and the announcements in the last 2 weeks have not done that. So at this time, we are in a position in which we have an enormous testing backlog that is affecting families trying to go into long-term care to see their loved ones. We don't have a systematic response. The summer was not spent getting staff into the homes. While there is new funding, it's not clear what strings are attached to ensure that it actually goes to improving the care levels and not off to dividends for the for-profit homes, for example, who have continued paying dividends to their shareholders or profits to their shareholders throughout the entire pandemic. So we have a very serious problem. We are extremely concerned at the Health Coalition that we have not seen the measures that would stabilize the workforce, that we're now into a second wave in which long-term care homes have less resilience than they did in the first wave to deal with the staffing crises that come when there's an outbreak. That already staff have worked enormous overtime. They have sacrificed a great deal, that we'll lose a lot more in a second wave. And unless we see government action now, it really needed to happen yesterday, months ago, but any action will of course help to improve things. It's got to start, but unless we see it very soon, we are very afraid for what is going to happen to people living and working in long-term care homes in this second wave. So that's my briefing. I can give you more details on the numbers if you'd like, or any of the other details, but we'll open it up for questions and answers now.
Okay, so I will read out some of the questions that we've received so far. The first question from Matthew is, for the PSW training announcement that was made, are they intending to have the private sector do the training, or will it be in the public sector? And also, how much money has been assigned to that training? I know you talked about the wages, but how much funding has been announced for PSW training?
Um, I don't have the exact amount in front of me, but there was sort of piecemeal funding for PSW training. Our point is that there is no recruitment strategy. It's not like Quebec where the government has actually gone out on a recruitment drive, set a goal of 10,000 PSWs, recruited them, trained them, paid them for training, and gotten them in. There are pockets of money available for training, but not a sort of holistic kind of strategy for doing it. As for the training, it happens in an array of places, some high school programs, some college diploma programs, some are private, some are public.
Okay, the next question is from Bonnie, and she asks, are the long-term care homes that were previously ordered under management of local hospitals, are they still under that management, or are those long-term care homes running themselves now?
No, I think all of, from the first wave, to my knowledge, I believe that they have ended. Now in this wave, the chief medical officer of health in Ottawa ordered the hospital to take over two long-term care homes in Ottawa. And so to my knowledge, those are the two that have hospital orders for takeovers. I should have sort of pointed out another problem, which is that in the first wave, hospitals had closed their clinics and their surgeries and diagnostics by and large, and for at least for elective procedures, and had a fair amount of capacity open. In this wave, hospitals are open, and across the province, they are reporting that they're at, close to 100% capacity in all of the large towns, or over 100% capacity. In the first wave, although they were, belated, far too late and far too little, so-called SWAT teams or rapid response units were ordered in from hospitals into long-term care homes to help out with infection control and so on. But of course, at this point, for example, in Ottawa, the Ottawa hospital is running at more than 100% capacity. It didn't have the capacity to send in a rapid response unit. And it has apparently done so as ordered by the chief medical officer of health, but there is a capacity issue in which we either need the capacity from hospital teams or for community-based teams. They need to be set up, they need to be ready to go a lot faster than they've gone. And of course, that just does not replace all of the care on the floor. It doesn't replace the missing PSWs, the missing RPNs, RNs in the homes that provide the hands-on daily care for residents, or the housekeepers that are short, and the dietary staff. All of these staff are vital, and many homes are missing many of them. So the SWAT teams, the so-called SWAT teams, are kind of an emergency stopgap measure, but they are not adequate to replace the full-on staffing problem that the homes have. And now that the hospitals are full, the question is, where are they going to come from? And again, there is no plan. There's just no plan from the provincial government for any of this. And it needs to happen yesterday. And our position is, if you cannot safely provide care in the homes with the existing staff, which in Extendicare's West End Villa, the staff were reporting they had 2 PSWs for 60 COVID positive residents. That's 1 PSW for 30 COVID positive residents. Imagine walking into work and you're tasked with the daily care of 30 COVID positive residents. Where would you even start? I mean, that's impossible if they were healthy. It is not possible when they're isolated and they're sick. It's unspeakable. And those are the kinds of conditions that we're seeing right now in October in Ontario, if you can believe it. So our urgent appeal is, there has to be a plan. If you can't take care of the residents in the home, then you have to move them to hospital. If there's no capacity in hospital, then we need field hospitals or the like, somewhere where there can be a safe level of care, subject, of course, to the right to consent for the resident or their substitute decision maker, full informed consent. But either get staff in there or get them out to somewhere where they can be taken care of, so they don't die of malnutrition and dehydration.
So the next question comes from Ivan, and he's asking, so the province has been encouraging people to wear masks, and in Niagara, there are places that are supposed to have a mandatory mask policy, but they're really only being encouraged, so the rules aren't being enforced. Why isn't the province making stronger rules to enforce these laws locally?
So I'm having a hard time hearing you clearly, but I think you're asking about mandatory mask policies in the
Correct.
homes. So, I mean, I don't know exactly what the specifics are of the instance in which like that is being described, but um, the SARS Commission ruled that that there was when the science wasn't clear with an emerging virus like SARS or like COVID-19, although I think the science has become very clear with COVID-19 that it's airborne, um, um, or small particles that linger in the air, that you should adopt the precautionary principle, which means that in this instance, people should have access to N95 masks. I understand that the unions, Unifor, QP, SEIU, I think ONA joined in, I think some others joined in as well, called for a judicial review. I understand that they have a change to Directive Number 5 that gives all staff access to N95 masks as needed. And I'm not sure what the process is around clinical judgment. I haven't seen the new directive yet, but the way that the old directive worked was that there would be a risk assessment for each patient or each resident, and then according to the clinical judgment of the staff, they would have access to the appropriate PPE. And so now clearly that includes N95 masks, as I understand it. Again, I haven't had a chance to read. I haven't seen the final version of the directive yet. I think it's out today, and we can send it out to people if they would like to see it.
The next question comes from Lynn, and it's about the testing problem that exists in Ontario. Uh, was there not a federal transfer of $19 billion to the province for testing? And if so, why is there an issue with the testing?
I think the issue is that just there was no plan for the fall. There is money both in the Ontario COVID fund and the federal transfer of money. I think it's from our point of view, it's just a complete failure to plan for the return to school and the spike in demand for testing. So we need capacity. I think people understand this, but there needs to be laboratory capacity to process the tests, and then also assessment center capacity to conduct the swabs. And neither one of them was ramped up in the summer months in order to be ready for the school opening.
The next question comes from Doreen, and it's about the staffing study that took place back in June. And they were wondering what's happening with that that was provided to the government. Are they using it? Is there any follow-up on that?
There has not been any follow-up from the government on it. I think the study was very problematic because it did not recommend clearly a minimum care standard. It recommended 4 hours of care, but sort of with the homes policing themselves sort of voluntarily. Like, that's just not going to cut it. The majority of the homes in Ontario are for-profit homes. It also echoed a bunch of the recommendations from the for-profit homes for deregulation of an array of things, which we do not support. They're not in the public interest. So the study itself was problematic. I mean, and it paid sort of lip service to a minimum of 4 hours of care per resident. It kind of muddied the waters by including an array of sort of not daily hands-on care staff. They're vital. I'm not in any way diminishing their role, but they're not the daily hands-on care staff. That's supposed to be a measure of the daily hands-on care. Which is what Shirley Sharkey did. People may remember when the Liberals called for their own study of this, and she also did the same thing, I think quite purposefully muddying the waters, and kind of watering down the call for a minimum of 4 hours of care per resident per day.
Okay, and this question is tangentially related from Donna. The long-term care staffing advisory report that was released on the July the 30th, does the Ontario Health Coalition support that report?
Yeah, so I mean, to the extent that it paid lip service to a minimum care standard, and that, that there is not enough staff is a key issue, yes, but no, I mean, not in all of its recommendations. And actually, just we've been utterly swamped, but I will be putting out an analysis of that report for people to see. I think the vital thing, I think now what we need is something like, what we think is we need something like the Quebec government has done, in which government puts its full weight and power behind a big recruitment strategy. We recruit, the tens of thousands or 10,000 more PSWs and other staff that we vitally need in long-term care homes, pay them for training, get them into the homes post haste. I mean, it just needs to happen. And we need a minimum care standard. Staffing shortages beget staffing shortages because the workloads are crushing, because people get injured, and they end up on leaves, and because it's not safe, and they leave for other types of work. So, there needs to be a full strategy to get people into the homes and then protect the staffing levels at safe levels going forward.
Okay, the next question is going to be from two people. From Kelly, where are the PSW supposed to come from to address the staffing shortage issue? And then from Shirley, she's asking, are the classes for PSWs full now?
Okay. So where are they supposed to come from? Well, I mean, what we're talking about is training a whole raft of additional PSWs. We did do roundtables across the province with about 350 PSWs, home administrators, people who run the college programs, the PSW courses in the college programs. And what we heard was, when we asked where did the PSWs, where had they left to go to? So in the homes, all of them were describing a severe PSW shortage. What they said is that they left for the school board. Some of them left to work in restaurants where they got tips, other types of work where where it was safer, where the workloads were less crushing, and the culture was better, and where they had better pay. So there are PSWs out there in Ontario, but I think if the point is that we need more, we would not disagree with that, and they need to be trained. They need to be trained. It should have started years ago. It definitely should have started after the first wave. It hasn't started. It needs to start immediately. And what was the last part of that question? Sorry.
So for classes, are the classes for PSWs full, or was?
Well, I just heard that one in Niagara was, but it's not. We don't have reports in from around the province on that.
Okay.
Maybe people could share in the chat if theirs are.
The next question is from Myra, and it's about long-term care insurers and how they've been saying that they won't be. Are there long-term care insurers that are saying they won't cover COVID-related expenses, such as class action lawsuits against homes for neglect?
I don't know the answer to that.
Okay. The next question from Mervyn: should the armed force medics have a larger role in responding to the pandemic?
Well, again, at this point, I think we're in an emergency. I mean, I don't think we have many choices. If the hospitals are running at capacity and do not have the staff to redeploy, and staff need to be redeployed into the homes that are having outbreaks or that are severely short-staffed, they have to come from somewhere. So there needs to be a plan. The military is obviously like the SWAT teams or the rapid response units. Sorry, I don't like all of these terms, but they are the terms that are being used. So I'm using them just so people can understand what I'm talking about. But, these are none of them are ideal solutions by any means. But the alternative is to leave people without people to feed them, without people to bathe them or reposition them or spend enough time to be able to make sure that they're hydrated or that they have the basics of daily care. So that's, that is obviously that cannot happen. It cannot happen again. So there are going to be need to be now an array of emergency solutions, and we need to pressure the province to move on a solution that is more longer term, that gets the care levels up to something safe.
This question comes from Edward, and it's about what can we do to ramp up the political pressure, and what do you think the tipping point for change would be?
I find it shocking that it has not happened now. I'm sure you do too. I just, the reason that we called for a day of action on Thursday across the province, and posted on Facebook and on our website. There are events across Ontario. We're asking people to join in, car cavalcades, because obviously we are in the second wave, and we're not advocating that people hold in-person rallies generally, to have a show of strength and really pour on the pressure. And we're accompanying them with media conferences across the province. So that's happening Thursday. We'll see what the response is to that. We're doing nonstop media and trying to really get the word out so Ontarians understand that despite all of the nice words in the daily press conferences from the Premier, in actual policy, not, very little to nothing is happening to deal with these real crises in long-term care. And we just need to ratchet up the pressure. Everybody can contact your local MPP. Everybody can write to Doug Ford, the Premier, to Marilee Fullerton, the long-term care minister. We'll put up their, and to Christine Elliott, the health minister. We'll put up their contacts on our Facebook page under this video once it's recorded and posted. Everyone can do that. And, in every way possible, all of us can help to pour on the pressure. And please, if there's an event near you and you can join on October the 8th, let's make it, something they cannot ignore, just a show of public concern that is so large they can't continue to just ignore it and pretend that they're doing something when they're really not doing anything.
So the time is now 12:35. So the plan was for it to be a half an hour briefing. There were a couple more questions left, but
Can you
unfortunately,
combine them and I'll just answer them and then we can end?
okay,
Okay.
I will try to combine them. So, have there been any changes to PPE when it comes to long-term care, and has there been any government funding to increase PPE in home care and long-term care?
So that funding that I was describing, the 405 million that the government announced a week or so ago, that is funding for extraordinary COVID-related costs. There is additional funding for infection control that includes PPE. So they do, yes, have a bunch of quite a significant bump up available for PPE. The situation varies from home to home. In some homes we're hearing that people are given one surgical mask to wear per day, in some two, one per 2 days, and they are wearing it from resident to resident to resident in the homes. As I mentioned in the extended care outbreak, the staff had come forward to say that the frontline staff that were supporting the COVID positive residents were saying that they did not have access to N95 masks. So, it depends on the management of the home as to, how they're actually distributing the PPE. I'm sure many people have heard about the PPE being locked up and so on. That still exists in an array of the homes. So there have been improvements over the course of the pandemic in many homes, but there still are very severe problems in a number of homes that we've heard. It's problematic because all of the staff, they have gag orders in their contracts. They're not allowed to speak out publicly, so they can complain to the ministry line, but they don't really have recourse to sort of go public. It is encouraging to see that some staff have gone public anonymously to media outlets, and then change actually happens. But that's quite some personal risk for the staff, and so you can see why it's not happening across the board.
Okay, this question comes from Facebook, and it's about what measures are being taken to hold nursing homes and staff accountable. And there's another question that's tangentially related about how much does the profit motive affect the care levels and the way they've been dealing with COVID in for-profit homes?
Yeah, so I mean, uh, the government has reinstituted inspections of the homes. I think people know that there was a CBC expose during the first wave that the annual unannounced, the surprise inspections that were the full inspections, the RQI inspections, the comprehensive ones, had been canceled or somehow stopped by the Ford government after it took office. They are now reinstated, but inspectors can only inspect to the standards that are that they have in regulation to inspect to, and the RQI process. So because there is like a no minimum care standard in Ontario, there's no required minimum level of care. They can't inspect to that or penalize homes that don't follow it. Also, I think there is a very legitimate question about how many homes are actually paying any kind of penalties at all, even for non-compliance or even for routine non-compliance. And this is an issue that the families are rightfully raising, and we're raising it as well. It's a serious problem. Also, why have more homes not had the licenses yanked? I mean, virtually no homes. I don't think any homes, I may be wrong, maybe one or two, but I don't think any of them had their licenses pulled. These are long-term care homes. There was the Rosalind, it's a retirement home near Hamilton that had its license pulled, but not long-term care homes in the first wave, despite what is absolutely clearly negligence and total incompetence. And this is partly why the Quebec government has hired in a manager for each home, because you really just cannot trust the management in all of the homes to be competent or not to be negligent. In terms of the for-profits, there is definitely a difference in the level of care. All of the studies bear that out. All of the major studies bear out that the hours of care are less, that the outcomes are poorer. In our own experience, what we hear from the staff, and this is true across, this is supported by government data, is that the for-profit homes pay less. They have less benefits, so the working conditions are poor. They have more part-time and precarious work, so a less stable workforce. The municipal homes, which are the publicly owned ones, have a higher wage. The nonprofits generally in the middle. So municipal homes subsidize the wages, the working conditions and the wages from municipal taxes. So they put extra money into the homes and they supplement the amount of staffing. Similarly, nonprofits have their own fundraising and they do the same thing. The for-profits actually take money out in dividends for shareholders, and they have, they always have, but shockingly, they have through the pandemic, even as the staffing crisis intensified and became just a torrent of horror, and so they are quite different in the way they operate. I should say there are funding envelopes. The for-profits take their profits out of the accommodation envelope. The nursing and personal care envelope is supposed to be sort of sacrosanct. It's supposed to be protected. But clearly there's some leakage because the levels of care are lower. And also, as I say, the nonprofits and municipal homes are subsidizing to boost their staffing levels. That's generally speaking. I mean, there are terrific managements in all different types of homes, and there are terrible managements in all different types of homes, but that is borne out by the evidence across the board. Okay, I think we really are at time now.
Yeah.
So I just want to thank everybody for joining. I hope this was helpful. I really hope that you will please do everything you can to put pressure on the government to act now. It is obviously extremely late, but it's never too late. And please do join in on Thursday if you can, your local day of action. It's on the Ontario Health Coalition website, www.ontariohealthcoalition.ca, and on our Facebook page, the listing of the events across the province. And everybody can write to Doug Ford. You can send an easy, quick email, or Marilee Fullerton and the Health Minister, Christine Elliott. So please do everything that you can. It will, I hope, save lives in the end. Thank you for joining.